Acid-base balance, Nursing 102. The power of hydrogen is pH. pH is either acidity or alkalinity of the blood. We're looking specifically to blood. A normal blood pH is 7.35 to 7.45. If we have an increase in hydrogen molecules in the blood, we'll have a decrease in the pH of the blood, which makes it an acidic state. If we have a decrease in the hydrogen, we'll increase our pH, creating an alkalotic state. And remember, we measure all pHs of the blood and gases through an arterial blood gas. Arterial blood. An acidotic condition will have a decrease in our pH. We'll have alteration in cardiac contractions. Our pump will not pump well. We'll have a decreased vascular response to catecholamines, so our fight or flight will be down. We'll have certain response to certain medicines. We'll have poor response due to an acidotic condition and can lead to loss of consciousness. Alkalosis. It's a result in several metabolic processes, and it interferes with our tissue oxygenation. Blood has too much base or too little acid, it will increase in the blood pH. We have different buffers, and always remember your bicarbonate is the kidneys. It will produce to buffer acid, and you'll see this in the acute phase. Hemoglobin, phosphate, and learn your other buffers for the testing purposes. Alkalosis will have an impaired neurological function, impaired muscular function, and tingling sensations, nervousness, and muscle twitches. Great slide that gives you an actual visual of what you're looking at. If we have a decrease in pH, then we're going to have a decrease in the excitability of the cell. If we have an increase in pH, then we'll have an increase in the excitability of the cell. But up or down, no matter what, it is bad for the heart. It's bad on our cardiac system. Acidosis, alkalosis, caused by an imbalance in the production of excretion of acids or bases by the kidneys. If it's metabolic's kidneys, respiratory's lungs. Here are components of a blood gas. You have your pH, here's your norms. Please memorize the normal values. You'll need to know them. pH is 7.35 to 7.45. PaCO2 is 35 to 45, and a bicarb, HCO3, is 22 to 26 milliequivalents per liter. Interpreting ABGs. Remember, always first look at the pH, next look at the PaCO2, and then your bicarb, your HCO3. When you look at your pH, does the arrow go less than 7.35? If it does, it's acidotic. If it goes greater than 7.45, it's alkalotic. And if it falls between the normal values, it is normal. Once you determine that your pH is acidotic or alkalotic, then you move to the next. Then we move next, we're going to look at the PaCO2. You have already figured out you are acidotic or you are alkalotic. Then we're going to look at the PaCO2. If it is a respiratory acidosis or alkalosis, your arrow will go opposite the pH. So if our arrow is going less than 7.35, if our PaCO2 is greater than 45, we know it's a respiratory acidosis. If it's within the normal PaCO2, then we'll move to our bicarb, which is our HCO3, making it a metabolic state. So we will then be either metabolic acidotic or alkalotic. Once again, the breakdown of pH. Let's remember Rome. Respiratory is opposite, metabolic is equal. If it is respiratory, it's going to go opposite the pH. I just said that. If the arrow is going less than 7.35 that direction or greater than 7.45, our PCO2 will go opposite. So if our PCO2 is less than 35, we're alkalotic. And if our PCO2 is greater than 45, we are acidotic.
Okay, and then when it comes in, you guys just call us
It tells us what the kidneys are doing. It's our metabolic component. It follows the pH. So it's just like on the highway, what I used, the analogy I used in class. If we're on the highway, we're going parallel to each other. We're equal. We're married. We're going in the same direction. So if our bicarb is less than 22 and our pH is less than 7.35, we are metabolic acidotic. If we're greater than 26, we're alkalotic, and that would make our pH greater than 7.45. The arrows are going in the same direction. Oxygen. This is blood oxygen. This is not the SAT that you see on the monitor. This is what we're seeing on an actual blood gas. The normal will be 80 to 100 at room air. We prefer 90 to 100, and anything less than 80 is considered hypoxemia. Do you remember how I did the bell curve? So you want to intervene before we get less than 90. It's very important, because then it's a faster downhill fall. Respiratory acidosis, your pH is less than 7.35 and your PaCO2 is greater than 45. It causes obstruction of gas exchange and hypoventilation. So if we're going to hold on to CO2, we have depressed respirations. With depressed respirations, we'll become respiratory acidotic. We see it in emphysema, chronic bronchitis, severe pneumonia, pulmonary edema, asthma. Anytime we have depressed respirations, if we're seeing people on narcotics, illegal drugs, or sleeping medications, if you don't blow it out, you retain it. Respiratory acidosis continued. We'll have a headache, restlessness, confusion. It's the neuro changes. Increased CO2 causes vasodilation in the brain, which causes other issues. We'll have dyspnea, respiratory distress, shallow respirations, tachycardia, and dysrhythmias. The heart doesn't like acidotic or alkalotic states. Respiratory alkalosis, we're blowing off too much CO2. We can do this with mechanical ventilation, so we have to be very careful. It's caused by hyperventilation, breathing too fast. If someone hyperventilates, you can offer them a bag to rebreathe the CO2. It does work. Clinical signs: pain, fear, anxiety, fever. Of course, dysrhythmias, nausea, and vomiting. Metabolic acidosis. pH is less than 7.35, bicarb is greater than 22. It's not enough base in the blood, there's just too much acid. We'll see it with shock, diabetic ketoacidosis, renal failure, diarrhea, diuretics, certain drugs where there's not enough base. We're going to have a headache, lethargy. You're going to see small respirations underlying that one, nausea and anorexia, vomiting and diarrhea, and coma and death. You want to correct this state way before we get to lethargy, coma, death. Metabolic alkalosis is excess base or decreased acid in the blood. Too many antacids, people want to eat them. Gastric suctioning, always have your suction on low I take that back, low intermittent suctioning, not low continuous suctioning. If you continue to suck everything out of the gut, you will create an alkalotic state. Excessive vomiting, same thing. Clinical signs: dizziness, lethargy, coma, weakness, muscle twitching, cramps, and tetany. Buffers. We talk about buffers. Our lungs will immediately kick in. If it's a respiratory situation, they're going to kick in immediately to try to correct the situation. If they cannot correct it, then our kidneys will start to kick in. So we can have a respiratory state where we metabolically try to correct it if we cannot correct it by the respiratory system. And it's vice versa with our metabolic state. Kidneys can be slow to come to the party, though. Just always remember that.